Good morning everyone, and today's lecture is anticoagulants and antiplatelet agents. The coagulation is controlled by the number of substances, and there are factors that will decrease the platelet aggregation, that include the prostacyclins and nitric oxide, and there are factors that will increase the platelet aggregation, that includes a thrombin, that is the main factor, and thromboxane A2, serotonin, adenosine diphosphate, and also platelet activating factor. So all these substances will increase the platelet aggregation. If we look at the closer to the mechanism of the platelet aggregation, we can see that the two platelets will be connected with the fibrinogen, and fibrinogen is connected to the glycoprotein 2B3A that is located on the surface of the platelets. Then the factors that activate the platelet aggregation will activate these glycoproteins and increase the platelet aggregation. And also the platelets can be connected with the collagen with the glycoproteins 1A and 1B to the vascular endothelium. So this makes the can stop the bleeding, or can repair the damaged endothelium. So usually when the vascular injury occurs, locally the nitric oxide concentration is decreased, because the endothelium cells that usually produce nitric oxide, they are damaged and killed. So that is why locally at the place of the injury the nitric oxide level is decreased. That leads to the starting of aggregation of the thrombocytes. Platelets. To prevent this, but sometimes the platelets will aggregate even though there is no any injury, and that can lead to the unwanted clot. So, and to prevent that, we can use platelet aggregation inhibitors, and one of the most commonly used drug is aspirin, that is a cyclooxygenase inhibitor that inhibits synthesis of the thromboxane A2. Thromboxane A2 is produced from the prostaglandin H2, and prostaglandin H2 is produced from the arachidonic acid with the cyclooxygenase. Inhibition of this cyclooxygenase leads to the decrease in the thromboxane A2 concentration, and that will prevent the platelet aggregation. And then we have the phosphodiesterase inhibitors. This is dipridamole and recently cilostazol. These drugs prevent the breakdown of the cyclic adenosine monophosphate by the phosphodiesterase, and that will decrease the calcium levels, and that prevents the aggregation. Modern drugs for the treatment for the anti-aggregated drugs include the antagonists of the P2Y12 receptor for adenosine diphosphate. These are clopidogrel, ticlopidine, prasugrel, and ticagrelor. So these drugs are relatively new, was discovered at the beginning of the 2000s, and were very popular, have been very popular for the for the treatment of the platelet aggregation. But unfortunately, there was recently serious adverse effects was discovered that lead to the anemia. So that is why these are less commonly used at the moment. And then there are also antibodies for the glycoprotein 2B3A. These antibodies include apiximab, apitegromab, and tirofiban. They prevent the connecting of the glycoproteins with the fibrinogen that prevents the bridge formation between the platelets. So that is required for the aggregation. So these are the platelets aggregation inhibitors. Adverse effects include headaches. For the aspirin also it can be bleeding, and the monoclonal antibodies for the glycoprotein 2B3A are all injectables, should be administered slowly to prevent the anaphylaxia. So this, then let's move to the next group, the anticoagulants. Anticoagulants are divided to direct and indirect. Direct anticoagulants include the heparin and also low molecular weight heparin that can be under different names, like most commonly used is enoxaparin and also dalteparin. All these drugs have the same mechanism of action. They increase the activity of the antithrombin 3 to thrombin. As we remember, thrombin is the key factor for the coagulation, because after activation of the thrombin the process is irreversible. And there is also a fondaparinux that is acting on the 10th factor that is required for the activation as well. So thrombin is converting fibrinogen that is soluble to the fibrin that is insoluble, and will make the clot more hard to dissolve. In case of the adverse effect, that is mostly the bleeding, we can use antidote, that is protamine sulfate. So one of the most common adverse effects is the bleeding. That can be the bleeding from the nose, or gastrointestinal bleeding from the ulcer, if the patient has recently or chronic ulcer. Then we can also use monoclonal antibodies against the factor 10, that include apixaban and rivaroxaban. And also antibodies for the thrombin include argatroban and dabigatran, and bivalent antibodies are bivalidin and disiruridine. So these are recently discovered drugs, and they mostly affect the thrombin and are connected with the active site, like univalent antibodies connect with the active site of the thrombin. Then the indirect anticoagulants include uh, warfarin. Warfarin is inhibiting the synthesis of the active factors of coagulation by inhibiting the vitamin K reduction. So because vitamin K is required for the gamma carboxylation of the glutamate residue, so this is a glutamate residue, and carboxylic group is added at the third gamma carbon, this alpha, beta, and this is gamma. So here we have a second carboxylic group. This process activates the factors, clotting factors 9, 10, and 7. So the blocking of this reaction will stop the activation, and that is most commonly used anticoagulant in the outpatients. Then we have thrombolytics. Thrombolytics include alteplase, retiplase, and tenecteplase. And also urokinase and streptokinase. Urokinase from the urine and streptokinase from the streptococcus. And for the drugs that stop bleeding, we can use aminocapronic acid and tranexamic acid. So that I think that is it for the drugs. The summary of the medications and adverse effects are presented on this table, and we can see that the aspirin has a like most common adverse effects include the GI disturbances for the aspirin, but also Reyes syndrome and angioedema, bleeding, and bronchospasm, because bronchospasm is because of the leukotriene synthesis increase, and Stevens-Johnson syndrome as well. Then there are a lot of interactions, so then we can, if you look at the clopidogrel, has less adverse reactions, that is only bleeding and Stevens-Johnson syndrome. That is why it's more expensive than aspirin, and almost same for the other P2Y12 receptor antagonists or ADP antagonists like prasugrel, ticlopidine, and ticagrelor. For the antibodies, there are a lot of adverse effects, including nausea, vomiting, thrombocytopenia, and hypotension. So then, if we look the acetylsalicylic acid, so this is the metabolites include the salicylic acid, and the blocking of cyclooxygenase is made by the acetylation of the cyclooxygenase, because that blocks the enzyme activity. The ticlopidine, clopidogrel, prasugrel, and ticagrelor are blocking the adenosine diphosphate receptors, and the antibodies abciximab, eftifibatide, and tirofiban are blocking the glycoprotein 2B3A receptors on the surface of the platelets. like these are two receptors that usually are connected with the fibrinogen, but because of the antibodies already blocking this glycoprotein, there is no interactions. Then this is a reminder of the clotting process, activation of the cascades for the clotting factors. So there are two ways, intrinsic and extrinsic. Both of them will activate thrombin, but intrinsic is a little bit longer, so we have 12, 11, 9 and 10. On extrinsic we only have 7 and 10 clotting factors, and thrombin is the second clotting factor. Then this is the mechanism of action of the heparin. Heparin increases the speed of the antithrombin 3 activity. And this is the mechanism for the warfarin. This reaction we already seen before. So this is a carboxylic group of one of the clotting factors, and this is a second carboxylic group that is connected to the gamma glutamyl residue. Glutamyl is one of the amino acids of the polypeptides of the clotting factors. So I think that is it for today. Thank you for your attention, and see you next week.